Introduction. Context. Currently, there are many people who are addicted to alcohol or drugs, and because of this trend, our culture is affected negatively. This may seem like a small problem considering marijuana has been legalized in over 30 states. Alcohol is legal in every state, and not to mention the ongoing need to have access to painkillers for use with a prescription. It is what everyone else is doing, and it is legal, so there is no need to change. This is the message that resonates within the complex culture as a habit acquired as a member of society. Oftentimes, the dedicated staff have a hard time figuring out whether the clients have a mental health disorder or substance use disorder because they mimic each other in a dual diagnosis. So these clients are being treated for one problem and not the other problem, or more importantly, no problem is being treated at all. Problem statement. Tobacco and caffeine have been synonymous with recovery efforts. Tobacco can be seen smoked in between group breaks, while coffee can be seen at various 12-step meetings for the participants to drink. It is almost as though recovery has its own culture of norms and expectations to attend groups, work the steps, and stay out of trouble. However, this set of recovery efforts has been proven to be counterproductive to the recovery efforts they seek to attain. Tobacco is the leading cause of death for patients with an addictive disorder or psychiatric illness, while caffeine is associated with greater withdrawal symptoms and the potentiation of toxic effects of AOD. Research has shown that an underlying diagnosis exists in a vast majority of cases. This information suggests that a need for the treatment of tobacco and caffeine as the primary condition to support long-term sobriety. Research questions. This study seeks to resolve the questions associated with this phenomenon. The research questions for this study include: why isn't tobacco and caffeine use being diagnosed and treated properly? How could the diagnosis, prevention, and treatment of TUD and CUD be practiced properly? How can clinicians get people to stop using drugs? Are gateway drugs important in starting and stopping use of other drugs? Does culture play an important role in use? Are clinicians effective in limiting or ending use? Research methods. Golden Finish will address these needs for clients: prevention, education, and intervention, and clinicians: prevention, behavior modeling, education, and intervention, in a structured method that is both effective and efficient. At this stage in the research, the associations between gateway drugs, NRT, and job design will be generally defined as cultural habits acquired as members of society that ultimately affect the quality of care, requiring organizational change. Literature review. A literature review was conducted to examine the body of knowledge present to aid in setting the parameters for the study. Their review identified 10 articles that contained pertinent information about the topic to help determine the direction of the project. These articles contain information on 3 specific topics which aid in the development of the job design using NRT for recovery interventions. Look, think, act, cycle methods. The ideal population to involve in this type of action research are people in the action stage of change who want to change their circumstances related to their use of AOD. This would also include the parents or role models who understand that children of parents who smoke or drink coffee have a greater chance of smoking or drinking coffee and doing other drugs. This speaks volumes of the research that was conducted by Albert Bandura, which showed that the risky behavior of an adult was visually passed to a small child through observing and imitation. This behavior was documented through the changes in how the child played with their doll more aggressively and changed the way that we view psychology. Research procedures. Sources of data for this study will come from the use of several common instruments, personalized instruments, and questionnaires disseminated to study participants throughout the research study. These instruments include the TUD assessment, CUD assessment, nicotine urine or oral swab test, golden finish what about me interchangeable curriculum, and the NRT herbal vape pen. In an effort to gather more data regarding the phenomenon for the study, a pilot study will be conducted to determine both the interest levels and the effectiveness of NRT herbal vape pen. To conduct this pilot study, the research will center around the results from the previous feasibility study gathered from NRT herbal cigarettes questionnaires by replacing the previous NRT with the NRT herbal vape pens. In addition, data will be gathered from the caffeine assessment to gauge if there is a need for the NRT herbal coffee, which will have limited applications in use, i.e., 12-step meetings or break rooms and work settings due to availability and numerous sources. The goal of the study will be to gauge the interest levels present within the same urban community in the Cleveland area. The procedures and guidelines of the IRB will be followed and regulated by Aspen University. There will be a consent form issued to the participants at the onset of the study, followed by a summary of the rules and guidelines of the study. The rules and guidelines of the study will explain what is expected of the participants and what the participants can expect from Golden Finish throughout the study process. No personally identifiable information will be collected, and the study will use a unique set of numbers that the participants can remember as identifiers for the participants. Intervention detail. The researcher will inform the participants not to smoke for the next week and schedule an appointment to complete the intake paperwork after the week time frame. The participants will be given a consent form and the rules and guidelines, followed by the researchers performing TUD and CUD assessments. Once the assessments are completed, a tobacco urine or oral test will be administered to determine levels of tobacco within the system to start the research study. Upon completion, the NRT herbal vape pen schedule will be discussed and the NRT vape pen will be given to the participant. Next, the participants will participate in completing a scaling exercise to discuss the information received, and they are informed that this will be included at the end of each educational session. During this process, the participants and researcher will discuss the Golden Finish education schedule matching the NRT herbal vape pen schedule based on the lowest level of care. As a result, the participants will meet once a week for 4 to 8 weeks for a brief prevention education intervention, NRT herbal vape pen replacement, and tobacco urine or oral swab tests in weeks 1, 4, and 8. Data collection rationale. Data collection rationale can be summed up with 3 statements from a recent article by Renee Goodwin, writer for the Cambridge University Press. Goodwin asserted that increasingly data suggests that nicotine and cigarette use is also a barrier to long-term abstinence from alcohol, cannabis, and illicit substances. Goodwin also states, despite widespread tobacco use and co-use with other substances, comprehensive tobacco treatments such as counseling and pharmacotherapy are neither routinely accessible nor reimbursed. Goodwin continues suggesting that psychoeducation of providers and patients about the benefits of TUD treatment may be necessary due to the erroneous belief that continued smoking enhances mental health. Data analysis. Data analysis will require the evaluation of the assessment results, pre-test and post-test urine and oral test results, and scaling worksheets. Conclusion. The theoretical frameworks of existing theory and exploratory research will be used to examine the problem of TUDs and CUDs from a professional perspective to identify some theories and concepts that will be useful in resolving this problem absolutely. NRT, not to be confused with NRT or nicotine replacement therapy, along with other evidence-based sources of therapy, are proposed as a long-term solution that generates immediate results to treat previously untreated and undiagnosed TUD and CUD conditions to bring relief to both clients and clinicians.